So, how long do facial fillers or dermal fillers really last? The answer is how long's a piece of string. There's not an easy one I can just spout out and give you because this depends so much on many different factors. The product and the patient, not least of all, and also the area you inject them in. So, for example, fillers that we have now on the market are far more sophisticated than the ones that first launched in the 2000s. So, back then I would say that lip fillers used to last maybe around 5 to 6 months. Nowadays, I tell my patients that lip fillers usually last over a year, because we have products that are more resilient. It also depends on the area of the face that the product is injected into. So an area which moves a lot, like around the mouth, the filler will tend to last less long than filler in other parts of the face. So for example, the back of the cheek or the nose, where notoriously filler tends to last a little bit better. And then of course there's the patient factors. So patient's lifestyle, patient's metabolism, and just generally we all break them down at different paces. So I have some patients who genuinely their filler results don't last much more than 6 to 12 months, and others where they really do last significantly longer than that. So when I'm putting a treatment plan together for my patients and we're talking about how long fillers last, I tend to say for most people they're between 1 and 2 years. But what we don't want to do is wait for a patient to go back to where they started. So I see my patients a little bit more regularly, and that time frame will vary depending on the patient. And we do smaller amounts more regularly to tweak and keep people in sort of a steady state so they're not yo-yoing in the same way that we don't want to yo-yo diet. A little while ago now, we sent a journalist who's also a good friend of mine and a patient of mine called Alice Hart-Davis for an MRI scan out of curiosity to see how much filler she had in her face. And the answer was that there was more filler measured by volume in her face than she believes she has ever had injected. And certainly there was filler showing up in certain areas of the face where she hadn't had injections for at least 10 years. So we know, not just from Alice's case, but from other people who've had incidental types of imaging, so something called PET scans, where filler has showed up 10 years after being injected, that while results of filler might last 1 to 2 years, the actual longevity of the product being there can be far longer. I see that as a positive because it's helping to maintain the facial scaffolding as we continue to age. But it's only a positive if you're having good quality products injected, and those products are being injected by someone who is doing it well. And by that I mean also with strict attention to hygiene and cleanliness, because what we don't want is to introduce microorganisms, so little bacteria, along with our filler, because then if you do have a product that may last for 10 years in some capacity, then you could really get significant problems from it if that product were contaminated. So it's something that I think is a really interesting question. I think we need more research to see how fillers behave in humans over time, because all the clinical studies that the pharmaceutical companies do are far shorter. So the longevity we quote is based on the duration of the studies the pharmaceutical companies have conducted. So it will be interesting to see if at some point we can generate proper clinical data looking at the longer term. But in general, I think it's a huge positive if you've been responsible about your choice of practitioner and product. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.